Hello, my name is Rachel and welcome to the channel today. We're going to do a session for painful hips, so Pilates for painful hips. Now this session is all about doing exercises for mobility to release tension in your hips to help with pain. Now there can be lots of reasons for that pain. It can be from overwork due to running, cycling, dancing, all those things. It can also be wear and tear due to arthritis and age-related conditions. Essentially, the exercises are the same for anybody in those categories. All right, so it's about mobilization, gentle stretching, and releasing of tension. So that's what we're going to be doing in the session today. All right, so go ahead, get yourselves ready, and I'll see you in a moment. Okay, so let us begin. The first thing we're going to do is we're going to lie down and we're going to try and release some tension in the hip flexors. So this is a very common cause of pain in the hips and in the back. So that's what we're going to start with today, unusually for a Pilates class. So what I want you to do is lie down and you're just going to raise your right leg up and you're going to put your hands around your knee. And you're going to gently draw that knee in towards your chest. Now, obviously, you do not want to feel any pain. So if there's any pain, then you need to ease off. Otherwise, I want you to draw it as close to the chest as you can. And then I want you to then extend your left leg along the floor. And we're going to hold this position for a little while because we want to give those hip flexors a chance to release. And it does take a little while. All right, so it's very, very effective at releasing hip flexor pain. So let's just take a deep breath in through the nose. And then you're going to exhale through the mouth. We're going to inhale through the nose. And exhale through the mouth. You're just going to keep that breathing going. So inhaling and exhaling. Keep it going. You're just going to gently draw the knee in. And you won't want to adjust it slightly. You might find that taking it to the outside, a little further out, feels better for you. Or you might find drawing it a little bit towards the center feels better. Find the place where you feel you're getting that release. All right, we're just going to do 2 more breaths. So take a deep breath in. And exhale. And last one, deep breath in. And exhale. Now what's really important is you come out of this stretch very slowly, okay? Particularly if you do have hip flexor issues. All right, so rather than putting the leg down quickly, we're going to put our hands underneath here for a moment. And we're just going to take a breath in. We're going to breathe out. We're just going to extend the leg up and then inhale to lower down. We're going to exhale to extend up and inhale, lower down, and then exhale, extend up, inhale, lower down, and very gently we're going to place that leg down on the floor. Okay, so now you're going to bend the left leg, you're going to bring that knee towards you. Okay, so finding that place where you can get it in pretty close to the body, because that's what we need to do. We need to shorten the muscle in order to let it release. Once you've got that position, so I'd put the hands over the knees, you're going to extend your right leg along the floor. Okay, and we're going to do exactly the same thing here. So just take your deep Pilates breath, so inhaling through the nose and exhaling through the mouth. Inhaling through the nose exhaling through the mouth. Now you're going to keep that breathing going, and you're going to think about just gently drawing the knee in a little more if you're able to. And maybe just move it slightly to the outside or slightly to the inside. Find that position where it feels that it's starting to relax. And it's important to hold it still once you get there. Muscles take a little time to release, particularly when they're very, very tight. And they can be tight when you're running or you're cycling. They can also be very tight if you have arthritis. All right, so it is important to be patient with this one. All right, take a breath in. And breathing out. And one more deep breath in. And breathing out. Now keeping that knee where it is, let's just put the hands underneath the knee here. So keeping it in position. Going to take a breath in, and as you breathe out, you're just going to extend the leg. And as you inhale, you're going to lower down. You're going to exhale to extend. And inhale to lower down. Exhale to extend. Inhale to lower down. We'll just do one more. And extend. And lower down. And then very gently, let's take the leg and place it down on the floor. Let's bring the other leg up so both knees are bent now. Okay, we're going to bring our hands down by our side. We're going to take a deep breath in. And as you breathe out, I want you to engage the core, tilt the pelvis. And we're going to press up. So pushing into the feet, lifting up. And what you're looking to do is feel a lovely stretch all the way through the front of the legs. So you want a line between your hip bones, your thighs, your knees, a nice diagonal line. You're going to inhale there. And then exhale, coming down through your spine and all the way down onto the mat. Taking as much time as you need, okay? Inhale. Exhaling to tilt. And rolling that spine up. Pushing up through those legs. Inhale. And exhale. As you come back down. Deep breath in. And exhaling to tilt. And roll that spine up. Inhale to hold. And exhale. As you come back down. And last one, deep breath in. And exhaling to tilt. And roll that spine up. Inhale to hold. And exhale as you come back down. I want you to bring your feet and your knees together. Take your arms out to the side. Just turn the palms up. Okay, and we're going to take our hips over to the right, or should I say our knees over to the right. So keeping your knees together. You're going to breathe in, let the knees go over, let that left foot lift up, but we're trying to keep our top half still, going as far as you're able to. Then you're going to exhale, you're going to pull the abdominals in, and you're going to bring the legs back to the center. Then we're going to go the other way. So you're going to inhale as you go over. Exhale to draw the tummy muscles in to come back. And again, inhale as you go over. And exhale as you come back. Inhale as you go over. Exhale to come back. We're going to do it once more each way. Inhale over. exhale back, and inhale over, and exhale to come back. Bring your legs back into a neutral position. So that's hip width apart. Bring your hands down by your side. Now, very important that we keep our pelvis really still here. We don't want any tilting in that pelvis. So you're going to take a breath in. As you breathe out, I want you to pull the belly button in to stabilize the pelvis. And then we're going to just lift this leg up. And then you're going to inhale, lower, little tap to the floor, exhale, lift. And we're keeping our pelvis still all the time. So we're inhaling to lower and exhaling to lift. So we're working the hip flexor, but we are using our core to keep nice and stable. Exhale to lift. We're going to do 2 more. Inhale, lower. Exhale, lift. And inhale, lower. And exhale to lift. Let's take that leg down. Let's go on to the other side. So deep breath in, exhaling to lift. Inhale, lower, and exhale, lift. Inhale, lower, and exhale, lift. Inhale, lower, and lift. So keeping really still through the pelvis. 2 more. Lower and lift and lower and lift. Let's take that leg down. And we're going to do the 100. So this is a breathing exercise. We've got to really focus on staying really stable in the core, okay? So we're going to keep the feet down and we're going to lift the arms up. And if you feel okay to do so, you can nod your chin and lift your chest up. If you feel any discomfort here in the neck, then please put your head down. So we're going to start to move those arms. And here we go. We take a deep breath in through the nose, and then we're going to exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Exhale 2, 3, 4, 5. Inhale 2, 3, 4, 5. Last time. 2, 3, 4, 5. Inhale 2, 3, 4, 5. Now you're going to take your head and your chest down, and we are going to float the right leg up. And we're going to do nice circles of the hips. I want you to keep the knee bent so it's less pressure on your hip flexors, okay, and on the hip joint itself. We're going to keep the other knee bent as well because we're going to focus on stabilizing the core. And the idea is to create more mobility in your hips. Okay, so think of the top of your kneecap drawing like a semicircle almost. All right, so that's what we're going to do. We're going to inhale, we're going to take that knee forward, and then as you exhale, you pull the abdominals in. We circle the leg out to the side and up. Now I want you to stay within your comfort zone. Any clicking, any pain, then you need to reduce the size of the circle. Forward, circle out and up. Forward, circle out and up, and forward, circle out and up. We're going to reverse that movement. So check you're still in neutral. You're going to inhale out, exhale, circle around and up. 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 and one more out, circle around and up. Let's take that leg down. All right, let's lift the other leg up. Same thing on this side. So checking you're in neutral. We're going to inhale, knee goes forward, exhale, circle out to the side. Inhale forward, exhale, circle out to the side. Inhale forward, exhale, circle. Inhale forward, exhale, circle. And inhale forward, exhale, circle. We're going to reverse the direction now. So inhale out, exhale, circle around and up. Inhale out, exhale, circle around and up. Inhale and exhale. So keep within your comfort zone. We don't want any pain at all on this. We just want the movement. So you need to control it to where it feels appropriate for you. We'll do one more. Around and up. Let's take that leg down. And what we're going to do from here is turn over onto our side. We're going to come up onto the elbow. And we're going to do our side bend. I want you to keep your knees together. Okay, make sure the elbow is under the shoulder. Draw the tummy in, take the arm out to the side. So you're going to breathe in to lift up. You're going to breathe out as you go over. And as you go over, press into that elbow and try and lift the hip. So we're getting that nice stretch there. Inhale back to that T position and exhale to lower down. So we're just going to do 3. This is number 2. Inhale up. Exhale over. Lifting, trying not to round that body forward. Back to the T. And lower down. And last one, inhale. Exhale over. Inhale up. And lower down. All right, let's go straight on to the other side. So knees bent on the elbow. Tummy muscles in, arm out. You're going to breathe and lift. As you breathe out, we're going to go over. We're going to lift that hip into a nice stretch. Inhale and exhale to lower down. Going to take a deep breath in, lift. Exhale over. Inhale and lower down. Last one. Inhale, lift. Exhale over, inhale up and lower down. Okay, going to roll onto your front now. And we are going to have our arms, hands crossed, one hand over the other. And you're going to rest your forehead on your hands here. We're going to have our feet slightly apart. And I want you to think about tensing the muscles in the right leg and then keeping the leg straight and just raising it up. And then you're going to lower it back down and let those muscles relax for a moment. So think of tensing the muscles. You're going to feel this in the glutes, the back of the legs, and then lifting up and lowering down. And again, little tension of the muscles and lifting up and lower down. We'll do one more, tensing and lifting and lower down. Let's do 4 on the other side. So left leg, tense and lift and lower down. And again, tense and lift. And lower down. Tense and lift. And lower down. And one more, tense and lift. And lower down. Well done. You're going to bring your hands around. You're going to push yourself up into a kneeling position. Okay, and then from here, I'm going to give you a couple of options. If your wrists feel okay, you can do this on your wrists. If that's uncomfortable, then you can come down onto your forearms, okay? We're going to do the front support exercise. So this is where you're going to take the right leg back, the left leg back, the right knee in, the left knee in. So right leg back, left leg back, right knee in, left knee in. Now if that's too much, you can just reach the leg back right and come in and left and come in. And the idea is you're trying to keep as still as you can in your pelvis. All right, so you choose what works for you. All right, we're just going to finish up right and left and in and right and left and in and in. Well done. And then from there, I want you to come and lie down. And what we're going to do to finish is the bridging exercise, which will give you a nice stretch through the front of the hips here. So you're going to have your hands down by your side. You're going to take a deep breath in. You're going to exhale to tilt the pelvis and roll the spine up. And you're going to try and keep the hips in the air. So very important that you don't let the bottom start to drift down on this exercise. You've got to really push up through the bottom. Okay, and if you need to, you can put your hands underneath just to check. Otherwise, hands on the floor. And then you're going to take a breath in. And as you exhale, I want you to raise the right heel. Inhale to lower the heel. Then left side, exhale, lift. And inhale, lower. Right side, lift. And lower. Lift and lower. So just alternating sides. Heel lifts and lowers down. Lift and lower down. Lift and lower down. One more. Lift and lower down. So take a deep breath in. Exhale. Coming all the way down through the spine. Rolling onto your side. And come on up when you're ready. And that's your Pilates for painful hips. So I really hope you enjoyed that session, that you found it relaxing, and hopefully you got a nice release through the hips. So this is a sort of session you can do post-run, post-marathons. You can do it daily if you have any kind of arthritis in your hips. Okay, so do press the like button if you enjoyed it, and I look forward to seeing you again soon. Take care. Bye for now.